Hello, good morning. Today we're going to talk about sedentary behaviour, the dangers of it and how to try and reduce it. So sedentary behaviour includes watching TV, sitting in the car driving, sitting at a desk-based job, anything that has a really low energy expenditure rate. And we know that over the years our occupations have become more and more sedentary and we're not as physical and active throughout the day as we used to be. We're also spending more time watching TV and we're recognising increasingly that this is associated with an increase in all-cause mortality and certain medical conditions such as increased risk of cardiovascular disease, so having high blood pressure and having heart attacks, certain cancers and type 2 diabetes as well. So things we really want to try and avoid if we can. There have been two really nice studies that I thought I'd mention. One in Australia that looked at people who watched on average 6 hours of TV a day over their lifetime compared with people who watched fewer than this, and they predicted that the people who had at least 6 hours a day of TV, sitting in front of the TV, had 4.8 fewer years in their life than the people who didn't. And the second study was one in the 1950s that compared the heart attack rate in double-decker bus drivers compared to the bus conductors on the same bus. And they found out after several years of studying them that the bus drivers had twice the number of heart attacks than the bus conductors did, because obviously the bus conductors were going up and down the stairs lots of times during the day, so there's quite a big difference there. So it's long been recognised that there are hazards associated with it, and the WHO have got a really nice plan to try and reduce physical activity over the years to try and reduce our risk of getting chronic illnesses, the ones that we mentioned before. So how can we tackle it practically at home and at our workplace? So this is when we bring in the concept of NEAT, which stands for non-exercise activity thermogenesis, bit of a mouthful. And NEAT is all the energy expenditure that we do without really thinking about it, so kind of twiddling our fingers and typing and standing up to take a phone call, that type of thing. And so our big 3 tips to reduce our physical inactivity and sedentary behaviour are: number 1, to consider investing in standing desks if you're kind of desk-based for your work. Standing desks is something that we've invested in at the practice over the last year, and staff have loved them. They've commented that their back pain and joint pains are much better, and they tend to be much more physically active throughout the working day, which has been great. If you don't want to spend that much, you can improvise. I've seen people using ironing boards and propping up their laptop on an ironing board and a few books to see if that improves things for them at home. Second of all, try to go for a 20-minute walk every time you have a big meal to stop you from kind of sitting down straight away afterwards and getting moving a bit. And when you are watching TV, try to use the TV advert breaks to get moving and to improve that. I hope that's helped. Bye bye.